Well, we had decided that we were going to go do the Sirolimus trial.
In Cincinnati.
Well, period.
Yeah.
And then at one point, Riley didn't want to do it.
Oh, right.
Really? Why
Yeah.
not?
You know, this is a kid that has had ungodly amount of medical intervention, and I don't think she wanted it anymore. You know, and we couldn't say this is going to do anything. We still to this day can't. But luckily she changed her mind again.
She did. It was a process for all of us. I think we really wrestled then with like, okay, so do we force her to do this? What's that going to look like? It was a kind of a multi-month process to kind of work through that with lots of different people. And in the end, she came back and made the decision that she wanted, if it was going to potentially or maybe decrease the need for surgery in the future, that she was willing to try it.
They are experiments, that's absolutely fair to say, but there should always be potential benefit, and that the potential benefit is worth more than the potential risk. Sirolimus is a really interesting medicine. It was developed originally to be a medicine to treat fungus, and as it turns out, it was better at suppressing the immune system than doing that, so it's actually been used in adults and older children. That's what it's FDA approved for immunosuppression, so to suppress your immune system if you receive a kidney transplant or a liver transplant or a heart transplant. The other options for CLOVES syndrome patients are procedures. So their removal of the lipomatous masses, their procedures to handle vascular malformations. It's not a syndrome in which medicines have been tried, but it is a syndrome in whom you have progressive or changes in the malformations and the fatty overgrowth, the lumps. And because there is progression, and because she is a young girl who does have some symptoms, I think she really does stand to show some benefit. So it's very helpful to know and to hear today, as we interviewed her and went through, that she's really tolerating the medicine very well. She's not having major side effects. She's having all things that we had expected and talked about.
I've gotten a lot of mouth sores, but mostly it's okay. Mm-hmm. It tastes horrible.
Like what?
Moldy peanut butter. I sometimes feel like I'm hopeful, but sometimes I'm like, I wonder.
So I really want to be hopeful about this trial. Like, I really do. I also feel like nothing else has worked, so why would this? Like, that's where I'm at. And it's interesting because Riley said something very similar.